Well, welcome, Dr. Troso. It is so great to have you on my podcast. I'm super thrilled and honored that you actually reached out to me on LinkedIn and we just had this connection. We got on the phone and we talked about some really important issues that we want to talk about, and your professional background in oncology. You are an oncologist in women's health or gynecological and breast cancer.
hmm
And so I'm just so happy that you're here. How are you doing today?
I'm wonderful. Thank you so much for having me. This is such a pleasure.
Great. Well, you're in New York, so it is, I think, around almost 6:30 there. So I
Yeah,
think this is during your dinner
yeah,
time.
it's okay.
You
I'm
are.
still having coffee.
Oh, okay. Well, that's okay. I have coffee at that time as well. So especially iced coffee. I love it. You have quite a few things that are going on, and you have a Facebook page that I have been following and a passion project that we're going to talk about in just a little bit. But first, I would really like to talk to you about your journey and how you became, like, what led you to become an oncologist in, gynecology and breast cancer. Or yeah, sorry.
It's hard to track it all the way back. I can tell you that I remember my mom's mother dying of thyroid cancer. And she was living in our house when I was a little girl, and it's a very vibrant memory of mine. And my mom taking her mother to radiation treatments and to chemotherapy, and I was still little, so I was in the back seat being hauled around everywhere during the summer breaks. And so, I think that probably had a very large effect on me wanting to become a doctor. Um, in general, I I majored in molecular biology at Princeton as an undergraduate, which sounds super geeky, but it was fascinating. I absolutely loved it. And one of the things about molecular biology is that it leads directly into oncology. So much of what we're doing now in terms of specific ways of treating cancer really was born out of that development of molecular biology. And so when I decided to go to medical school, I started in internal medicine, and we would have these clinics, and you'd be a medical student and then later on as a resident. And it was very frustrating to me because I would find that I wasn't really making a difference for my patients. And interestingly enough, you'd have a patient come in, high blood pressure, and they were smoking. And I'd say, okay, well, we're going to treat you with this medicine, and I want you to check your blood pressure every day, and I want you to cut down by one cigarette, and I'm going to hook you up with this person to help you quit the smoke. 3 weeks later, they come back, the blood pressure's through the roof, they stink like smoke. And, well, what happened? Oh, I didn't feel like taking that medicine, and I don't know. I don't really feel like quitting smoking and what have. Anyway, that's just one little example, but I really found it difficult to get through to patients to feel like I was helping them. Sometimes you feel like patients don't actually want to be helped. They're there because their brother or their mother or their kid made them go to the doctor. At any rate, I did some rotations at Memorial Sloan Kettering in the city, and I was fascinated. Now, all of a sudden, I'm seeing sort of the convergence of the science that I loved and the medicine of people that really needed and wanted help. They really wanted you to help them, and really were. It was a passionate type of a field because you're really in the trenches with your patients, so to speak. Um, and then it just developed from there. So I knew I wanted to become an oncologist. And when I did my rotations as a fellow, I just gravitated towards women. I just started doing, I- you know, for what it's worth, I feel I'm generally pretty personable. I have lots of girlfriends and I like to talk to people. And I think that's really actually, I try to bring some of that to my relationships with my patients. And so I just found that I gravitated towards women patients and women cancers because I could help them, not just on a medical level, but sort of on a little few other levels as well, on deeper levels sometimes if necessary. And I found that very rewarding. And yeah, it's a, it's definitely a field that you go into not easily, not lightly, obviously, because you're dealing with very heavy topics and a lot of emotion. But it's a work of passion, and it's definitely like it's a calling, so to speak, I would say.
Yeah,
It's a
I
long
like the
answer.
f no, it's a perfect answer because it really, makes me think about how lucky people are to have you because of the fact that you love women, you wanna lift them up, you wanna help them, you're friendly, you cultivate a nice relationship with them, and that's very comforting, especially during such a scary diagnosis,
Hmm.
and I'm that way too, and so I would like to, have that kind of relationship with my doctors. So thank you for sharing that. One of the things that's really difficult when we become diagnosed is it's incredibly overwhelming, all of the terms and records and things like that. It's like we don't understand what the heck we're even looking at. So there's an overwhelming amount of like medical terms that are difficult for patients to understand. How do you help patients understand the medical jargon that can confuse and overwhelm them from the beginning of their diagnosis?
Yes, that's an excellent question and very, very timely. So in my own practice, I just try to make sure that with each thing that I'm talking about, that I either give it a reference or an alternative way of explaining it to make sure that they are understanding what I'm saying. Um, can I give you like a quick example?
Yeah.
So for example, patients don't necessarily understand the difference between a CAT scan and a PET scan, right? So I'll have some patient come in for a second opinion and be like, oh, they only will give me CAT scans. They won't give me a PET scan. So, well, with ovarian cancer, for example, sometimes a CAT scan gives you more information than a PET scan, and here's why. And I'm pretty good at breaking down technical things and explaining them to people on a layman's level. And so the analogy I always give is that a CAT scan is like a map, like a geographical map. When you look at a CAT scan, you can see basically a CAT scan is done by they take X-rays more or less like this, like slices every couple millimeters through your body, and then it's projected up on the screen, and you can see the geographical landmarks in the body. So you can see the liver, you can see the texture of the liver, you can measure physically things in it. And I liken that to a map. So if you're watching the news, I don't know if people do this anymore, but when I grew up, we would watch the news and you'd watch
Yeah.
the weather, and the weather guy would put up the map and you'd see, well, New York, the tri state area, New York, New Jersey, Connecticut, Long Island, what have you. And that's a CAT scan. Then, when he was talking about there's going to be a heat wave, right? And it's going to be 90 degrees in this sector, and that's red. It's going to be 80 degrees in this sector, and that's orange. 70 degrees is yellow, etc. So those levels of intensity, that is the equivalent of a PET scan uptake. So PET scans are done by giving a patient intravenous sugar that is radioactive, and the radioactive sugar localizes to a tumor, and then the tumor glows bright on the scan. Now you need the CAT scan with the geographical to overlay with the PET scan so you know where the glow is, right? So depending on what you're looking for, if I want to know if a tumor or a lymph node shrunk from 3 centimeters to 2 centimeters on a scan, I want a CAT scan.
Mhm.
If I want to know if that spot that I see here in the lung or in the bone is actually active cancer, I want a PET scan. Now, obviously, that's a simplified version of all that, but that's the kind of way that I try to explain things to patients so that they understand the decisions that I'm making and why. Because otherwise, you go out on the street and Aunt Betty says to you, "Well, everybody else gets a PET scan. Why didn't you ask you?" So, and it's so I just like my patients to really understand what they're doing and why, and so that they can participate in the decisions as well.
Well, you certainly just opened my eyes because I had no idea of any of that. I actually have had it all. I've had MRIs, CAT scans, PET scans,
Hmm.
and my last one I think I just had, yeah, I had a PET scan. I had no idea why. And I have been very curious about it. I can read about it, but for
Hmm.
you to put it in an analogy like that makes me understand it totally better. So thank you.
You're
And
welcome.
these are things
These are the
that,
things I do. Yep.
yes,
Yep.
yes. And I mean, and it doesn't I feel like that we need a whole lot more of doctors like you so that I mean, because if somebody doesn't ask, and there are a lot of people who don't ask those questions, I feel like I would want to have my doctor tell me anyway. And I'm a teacher by nature. I taught for
Hmm.
20 years, middle and high school kids, and I used to use analogies all the time. And it was amazing when you would see their eyes light up and think to themselves, "Oh, that's why we do this." Okay. And so, I mean, and even I understood it better when I used analogies. So, okay, well, I'm really happy I just learned something really awesome. Um, yeah, and it's just scary anyway, just not like, what are we doing today? Why are we doing that? Why are we taking this blood? Why, you know? So, thank you for being that kind of doctor. So, why is it important for providers? You had mentioned something about decision making. So, I'm obviously you're a shared decision making doctor. You like to make sure that your patients know what's going on and making decisions together, having them have more knowledge. So, why is it important for providers to partner with their patients in order to make decisions together and help their patients feel more at ease through their treatment, recovery, and healing process?
I think the first part of your question answered the second part of your question. So, doctors need to partner with their patients and make sure that they really understand what they're doing and why they're doing it, because otherwise, you're asking patients to just have blind faith in you, which might have worked 40, 50 years ago. They called it like paternalistic medicine, but that's not how people function anymore. People want to participate in their care. And if you're not going to tell them, they're going to look or listen somewhere else. So I would much rather that I'm the one that's explaining things to them and they can ask me questions than they go home and they Google it, because then they get it all wrong and they put it out of context. I almost, and another analogy, like patients, with the Information Act now, patients are getting the reports from their CAT scans online in their charts, sometimes before I even see them. And so,
Yes.
and their blood work and what have you. And they'll print them out and they will go through it and they'll Google every single word that they don't understand and write. I mean, I have patients coming in with scans that I think are terrific and they're in remission and they're in tears and in having anxiety attacks, because you got to put it in perspective. Like, you have to look it through the lens of somebody who reads them all the time and what this means and what's important here and what's not. It's not necessarily just the words on the page. Yeah, does that make sense? I
Yeah.
just feel like it's just, I like to empower my patients so that A, they're confident in me to know that I will tell them what they need to know, and B, that they don't feel like they need to run around and get information because I'm not telling them anything.
Yeah.
So
I mean, that's
yeah,
people like to Google Dr. Google. Well,
don't.
look at
Just
Dr.
don't.
Google. Yeah.
Just don't. Find another doctor if your doctor isn't educating you properly. But I talked to you about my passion project. Could I talk about that a little
Yes,
bit here? Because
yes,
that
yes.
kind of feeds in
That was going to be my next question. Yeah, go ahead. Just, yeah, a little sneak peek there. Go ahead.
So, as I alluded to before, I'm a specialist at a cancer specialty hospital, and so I see lots and lots of second opinions from around the country and from my region, what have you. And it has amazed me for years how little patients understand. They don't know what chemo they got. They don't even know what their cancer is called, what stage it is. They don't know what the difference between a nodule and a tumor is. By the way, there's no difference. These are like synonymous words, what have you. So I started writing things down. Like, I just started, like, one day I was like, what is going on? I went home from work and I made a list of all the things that I explained to patients that I thought should be common knowledge, that they should understand. Um, and I just started writing. And it's because I've been doing this for over 20 years and because I am the kind of doctor that likes to explain things anyway, it just flew out of my mouth and onto my computer and all that. So I've written chapters and chapters of just this kind of information. Um, so patients can understand just basic things. I have a whole unit on stage versus grade, and radiology stuff I was talking to you about before, and all kinds of immunotherapy versus targeted therapy and chemotherapy, and I just use all the vocab words and stuff. Anyway, so my plan is I am going to be launching this as an online course, and I'm collecting people right now in my Facebook group, called Winning the Cancer Journey. And as soon as I hit a sort of critical mass, I'm going to start launching my course. And I also I'm working on an app that is going to be utilized by my patients for some symptom tracking, as well as I'm going to run the course on there also, so that you don't have to be sitting at a computer. You can actually just watch it on your iPad or your phone or what have you. Um, and, access the chapters at, as you see fit. Um, I don't know. I have more I could say about that, but I'm sure you have other questions. So.
Oh, I'm just excited because I'm in that group. And what I really truly love about how you're running that is I know that you're waiting until you get this critical mass, but you sit there and you drop the most, beneficial information in there quite often. You've gone live with people, or you have Zooms with people. You have, there's just so much that you have in there that I have learned from you just in the short period of time that I've even known you. So the content that you have in there is amazing. So thank you
Oh,
for
thank
doing
you.
that.
Yeah, thank
I've
you.
invited a few people on there, and
Hmm.
they are also thoroughly enjoying that. So if
Good.
to my audience, please, go to the Winning the Cancer Journey. It's a private group, and Dr. Troso is just such she has so much knowledge, and she posts, some very engaging posts in there. So I'm really excited. I would like to take that class because just in this short period of time that we've been talking about, I didn't know there was a difference between a tumor and a nodule.
No, it's the same
Nobody
thing.
ever explained that. Yeah. Okay. And
Yeah.
so vocabulary words,
Hmm.
knowing the difference.
Yep.
Yeah. So the course, is it going to be something that is like multiple steps that you take to just continue, to continually learn? Like, I mean, how is that going to look? What is that going to look like?
So I'm still working on that. And I actually may survey the people in the Facebook group to see how you would like to see it. I don't want to release 20 chapters at once. I think that would be overwhelming. I think people would kind of be put off by it. I'm actually thinking about trying to use it as in a stepwise fashion in terms of, you know, certain basic things and then get more complicated. Um, for example, very specific, I could get into very specific things about different cancer treatments. Like I wrote a whole chapter on what's the difference between a SERM, a SERD, and an aromatase inhibitor. So very specific to breast cancer. SERM, selective estrogen receptor modulator, that's tamoxifen and Evista. A SERD, selective estrogen receptor degrader, that's Faslodex, that's an injection. And now there's a new oral form that just came out as well. It's very exciting. And an aromatase inhibitor, AI, they're called, right? There's three of them: Femara, Arimidex, and Aromacin, also known as letrozole, anastrozole, and exemestane. People know the trade name or the generic name, depending on how the doctors refer to it. And there's a difference in how those three things function. There's a difference in the side effect profiles, and there's a difference in terms of responses to the drugs. And so, people are very interested in knowing and understanding that difference. And
Yeah,
that's
I know
part of,
I am. Yeah.
yeah.
And I mean, just a lot of people don't even know that there's a difference between the name of the generic brand and the
Right.
actual
Oh, you're
brand.
right.
It's like,
Actually, you're right.
so confusing.
Uh-huh.
Well, and
You're
are
right.
you going to do like any, like videos? I love
Hmm.
how you present yourself. And so even like video clips on for each chapter or whatever it is to be
Hmm.
able to explain things. Cause I know that there's some people who, are visual learners, they
Hmm.
audio learners and things like that. I am so
Right.
excited that you're doing
Thank
that. Thank
you.
you. I can't wait to, really actually share that with other people, because that's my whole thing about this podcast, is that I wanted to be able to shorten the learning curve for people who were diagnosed with, like, are going to be diagnosed, and then help them through their journey.
Yep.
And so just having us all working together to
Hmm.
help people and help them not, because it's so scary, such a scary journey. Okay, so I would like to sort of finish off by, well, first of all, do you have anything further to say?
Um,
How
no,
about
I mean,
this?
what?
Yeah. Can you give our audience one big piece of advice for people who are just newly diagnosed? What one big piece of advice do you have for them?
So I have a whole chapter I wrote on how to prepare for your doctor's visits and how to survive your initial journey. Simple little things, simple little things. I tell all of my patients, for example, to go out and buy one of these. Everybody should have a nice planner. I like big ones. They should have the monthly and then the weekly where you can see each day.
Okay.
And some people say they like to do it on the phones, but I'm a kind of a paper guy, and I think it's easier to share with people when it's on paper. Anyway, this becomes sort of your cancer Bible. So not in some people will take a journal and such, but I instruct my patients to take these monthlies and immediately put in there all of their cancer appointments with any kind of specialist or doctor, anything relating to their cancer in here. So you can have that at your fingertips. And then I use the weekly where you have these nice big boxes for each day. And I tell my patients what to journal on. So I want to know, especially if you're on chemotherapy, I'm specifically actually talking about patients on chemotherapy, but or what have you. You can use those in the beginning to take notes from, which doctor's appointments you went to on those various different days. You can, but once you're on treatment, I like to have my patients journal in there. And I have specific things I want them to track. I want to know how much water are you drinking? I want to know, are you moving your bowels? Did you have to take something? Are you nauseous? Did the Zofran work or do you need something else? And because otherwise patients come back to me 3 weeks later or 2 weeks later, whenever their next cycle of treatment is, and they're like, oh yeah, I was nauseous. Well, when were you nauseous? What days were you nauseous? I don't know, sometime after the chemo. Well, if you're nauseous on day 2, is different. I would manage differently than if you're nauseous on day 8 a week later. And there's all kinds of things that we can do to micromanage the side effects and the symptoms for patients if we can know exactly what's going on. And so I give my patients a list of the things I want them to write in here. And I just find it to be an excellent communication tool, as well as a power, a control thing for my patients as well. Because part of getting diagnosed with cancer and being launched into this whole system is a loss of control. Now, all of a sudden, you're not in control. Somebody's, people calling the shots for you. They're moving you here from there. You got to do this. You got to do that. If you can control little things in your life, it helps feel more secure in the bigger things.
I wholeheartedly agree with that. That is such a great piece of advice. I wasn't really told that. I kind of did that on my own, and it's just because it's my personality. So I did put a lot of things in my phone, but I actually went out. Actually, a friend of mine bought me this really nice calendar, and I did write everything in there. And every single treatment, I wrote down when I was supposed to take this drug, this
Mm-hmm.
whatever, that, and go in here
Yep.
and then go get my bone shot, and then and but what I didn't do was actually write down when I was nauseous or when I felt like I had heartburn and what days. So that's such great advice to be able
Mm-hmm.
to journal in there and say, hey, go back and say on 2 days after the chemo, I was feeling nauseous. And even if you can pinpoint it, like in the afternoon or whatever it
Right.
is, that's such great
Right.
advice. And I really hope that more oncologists are able to tell their patients that and give them that power, and I think that's just great. And that's something I haven't even told people. Like I talk to a lot of people who have been diagnosed and I'm sort of helping through, and that is definitely one piece of advice I will put in my little repertoire of advice. And then
So
also making sure that they come to your Facebook page or your Facebook group, because I just think that part really empowers them as well, is having that kind of knowledge and that support. So thank
I
you. And
also, for what
go
it's
ahead.
worth, I also started making. I'm going to put it in the Facebook group when I launch it, but I have an Amazon store that I made that I basically pulled about 25 products. It doesn't have to be exactly those products, but 25 products of things that I recommend to my patients to help make their journey easier. And it's things like that book. It's things like you got to have a water bottle with a measurement in it because you need to know how much water you drank. And I don't want to hear about mom drank 6 of these. No, come on. Fill up a bottle, and when it's empty, you're done. there's that, and like cooling gloves, and which moisturizers I recommend for your hands, just stuff that over the years I've just accumulated and have found worked well. So I thought
That
that.
That's great. I sort of started doing that too on my link tree and
Uh-huh.
putting, some of my favorite things in there, like
Mhm.
books and products and all of
Mhm.
that stuff. So, since you have that, is there any way we can put that in the show notes for my guests? Like in some sort of
Um,
like a Google Doc or whatever it is, and then we can have them see what you recommend.
Absolutely. I'll get that to you.
Fantastic.
Certainly.
And then what else do you have in our show notes? Any kind of resources that we can share with besides the Facebook group? I've got that, and how to
Mhm.
reach you. What else do you have in
I
there?
have LinkedIn. I'm on LinkedIn, and I usually cross post between Facebook and LinkedIn. I haven't launched yet on Instagram. I haven't had the nerve.
Do you
But
need some help with that?
Liz, I have no problem talking, but I feel like every time I have an idea and I want to discuss it, I've got to put my makeup on and blow my hair out or something. So because then you're right there and you're in everybody's face, like right there. So I have to get over that, I think. But if I could just put information up. My son's a big Instagram and TikTok guy, so he can help me actually produce them. That's fine. I just haven't. I don't know why I'm nervous about it. I have no problem talking or
Yeah.
being seen.
Well,
I don't know.
and going live and things like that. I know.
Yeah,
And
yeah.
so every time I do an episode like this, I do video it because I use the video clips, but the same thing is like, okay, I better put some lipstick on or something like that. But we're human beings, and we're just having a conversation, like having coffee and having a
Yep.
conversation. I was kind of the same way with Instagram, and I've gotten over that, and now I'm jumping over to the TikTok world. And
Woohoo!
I haven't quite gotten over that. Apparently, you have to put something out that's spectacular.
Okay.
So
All
I
right.
don't know. Anyway, I think you're doing just fine. You are very well seen on the social media, on social media platforms. And obviously, we connected. And I feel very grateful
Thank
that
you.
you reached out to me. And I appreciate the fact that, the kind of oncologist that you are, and that empower women with knowledge, because we know that knowledge is power.
Yep.
And I love your passion project, and that you are so passionate about it and about educating women. And so thank you very much. I appreciate it, Dr. Troso, so much. And to my audience, please reach out, look at Dr. Troso's Facebook page, and hopefully soon her Instagram page, and
And LinkedIn.
LinkedIn
LinkedIn.
and
Okay.
LinkedIn. Yeah. And
Yep.
also her list of her products that she recommends. So thank you very much for listening to this episode of Test Those Breasts, and we'll see you next time. Bye, Dr.
Bye. Thank you
Troso.
so much. Thank you.